Test? Test? 1, 2, ja. Ja, passt.
Test. Passt, glaube ich. Ich soll noch mal, oh Gott, nochmal. Ich bin ja ganz tatsächlich laut.
Hallo, guten Abend. Ja?
Yes, okay. Okay, hello. Hello, how are you? Hello, how are you?
Violence of the
Thank you for coming tonight. Good evening to all of you. We'd like to welcome you to tonight's event, Lives Before Profits, a conversation with Winnie Byanyima on global health justice. I'm Elizabeth Masute. I'm a senior program officer at the Heinrich-Böll-Foundation.
And I'm Pia Schwedner. I'm a policy advisor at Oxfam in Germany.
And we are very glad that you're here tonight. We know it has been a tough 3 days for you, for those of you who joined the World Health Summit. And I would like especially to thank Oxfam Germany for co-hosting this event and UNAIDS for the very good cooperation. Before we start, there are some technical details. We do have a live stream tonight, so welcome to the audience on live as well. The stream will be in English. If there's anybody in the room who needs translation, English to German, we also have translation in the back. Falls eine oder einer von Ihnen eine Übersetzung braucht, Deutsch-Englisch, es gibt eine Simultanübersetzung. We will have a Q&A later, so write on all of your questions. You will get to ask them. If you want to tweet about the event, please do so under the hashtag Global Health Justice and @Böll_Africa. Afterwards, we would like to invite you for some non-alcoholic refreshments and snacks.
Thank you. Also, from me, once again, a very warm welcome and a special thanks to the Heinrich-Böll-Foundation for making this event happen tonight. So we're 3 years into the pandemic, and still hundreds of thousands of people around the world continue to be diagnosed with COVID-19 each day. But although we have developed effective COVID vaccines, therapeutics, and tests, and which are vital in keeping the pandemic under control, the supply remains grossly inadequate, with low and middle income countries stuck at the back of the queue. And this situation repeated what we experienced in early HIV treatment. Many of us participated in the World Health Summit in Berlin that is actually just coming to an end right now. There were many panels discussing the increasing importance of pandemic preparedness and response, or the global health architecture post-COVID-19. However, what question has fallen remarkably short during not only these panels, but during the whole summit, is what a true and social-centered global health order would look like. One that is based on the right to health for every person and put human lives before profits. That is why we are extremely pleased that we will be able to address these questions in greater depth tonight with Winnie Byanyima and Imme Scholz, who will now get a proper introduction.
Yes, I have the honor and the pleasure to introduce to you tonight's moderator, who will guide us through the conversation, Dr. Imme Scholz, who is the president of the Heinrich-Böll-Foundation here in Berlin since April 2022. We actually started on the same day, so I'm especially happy to have her here tonight. Prior to that, she's been the deputy director of the German Development Institute, DEI, since 2009. She is an honorary professor of global sustainability and its normative fundamentals at the Center for Ethics and Responsibility at the Bonn-Rhein-Sieg University of Applied Science. Imme Scholz is also the deputy chair of the Council of Sustainability and Development, where she's been active since 2013. And last but not least, she is also the co-chair of the Independent Group of Scientists, an organization that has been commissioned by the United Nations to prepare a second global sustainability report. Thank you so much, Imme.
Thank you, Ellie, for presenting me. And now I'm very happy to welcome you, Winnie Byanyima, to join. Please join me here on the stage. And I don't think I need to introduce you in very much detail. Please have a seat. You are the director of UNAIDS since nearly 3 years, as far as I know. And before that, you were, that's why we organized it together with Oxfam, you were the director of Oxfam International. And before that, you worked with UNDP. You were the director of the gender team in the Bureau for Development Policy at the United Nations Development Program. So I think this shows some of a bit of the knowledge and experience you have, which is very vast. So I'm very happy that you are here with us this evening.
Thank you. I'm honored to be here too. Thank you for organizing this session.
I think it was a pleasure for for my colleague. Look at her, how happy she looks. So I welcome all of you too. This is a small but select group, I think, and smaller audiences always have the tendency to be more intense in the Q&A at least. So thank you very much for being here with us this evening.
Since it is smaller, I'm going to be more direct, honest, challenging.
All right, that's good. Thank you. So Ellie has already mentioned that the Global Health Summit the World Health Summit has just finished here in Berlin, and Berlin, since the last few years, has tried to establish itself as a global health hub. It has created several organizations at German national level for that purpose, but it also hosts the new hub for pandemic and epidemic intelligence by the World Health Organization. And we are going to talk tonight on pandemic preparedness. And here in Germany, it is easy to get vaccinated. It is easy to buy tests. They are not expensive. Many places, you get them at your job. You get them. You don't even have to pay for them. You have access when you are a high-risk patient to Paxlovid for treatment if you need it. But in many places around the world, in most places, it's absolutely not like that, and probably this is one of the failures of pandemic preparedness. At the same time, we are feeling that, witnessing that the attention of the global debate is shifting away from the pandemic, and obviously is very much focused on the security threat, on the war which is ongoing in our neighborhood. But still, we want to focus on global health issues, and therefore thank you very much for being here with us and for getting into the topic right away. I think it is important, we would not like to start directly with COVID-19, but with HIV, AIDS. So the first thing I would like to ask you is, the mission of UNAIDS is to end AIDS as a public health threat very soon, actually, by 2030. Do you think that is a realistic time frame for ending it?
It's possible. It can happen. But first of all, thank you so much for the introduction. And to that question, it is possible. It's possible. Why? Okay, we have had HIV/AIDS, this pandemic, with us for 40 years. It doesn't have a vaccine, it hasn't been found, and there's also no cure. But in between those two, there's a whole range of medical tools for prevention, for testing, and for treatment. Plenty. To suit every type of person, babies, teenagers, old people, they are there for prevention, for treatment. There should be no reason today why anyone should get infected, because we know how to prevent. And there should be no one dying of AIDS-related disease, because we have good treatments. It's now like a chronic disease. You can live to a happy old age taking your tablets. But last year, we lost 650,000 people died of AIDS. And 1.5 million people got newly infected. All this is because these people suffer some kind of inequalities, face some barriers that don't give them opportunity to get the tools that are there. So I believe we can end AIDS as a public health threat if we remove those barriers. Mm-hmm. If we enable everyone who needs prevention to have it, and everyone who is positive to get on treatment, stay on treatment, and live a healthy life. It's possible. Mm-hmm. But we have to be bolder. Governments have to be bolder in their action. We need the global solidarity. We need all countries to cooperate, because it's global. Those with means, like Germany, should continue to put resources there. There are many other challenges, but they must remember that if they take their eyes off this, it won't stay where it is, it will increase, as we are already seeing. All the signs are that the epidemic is beginning to rise again in many regions, including the neighborhood here, Eastern Europe. New infections are rising. So we need the solidarity. The solidarity must include putting the money down, but also restructuring debt, reducing the debt of the developing countries who can't manage the bill of health because they are spending more on debt repayments. We must get girls in school in Africa. They are the most at risk, and it's because they are not in school. We must push away these laws that drive away gay people, transgender people, sex workers from coming forward to get help. These criminal laws, must remove them. We must put human rights there. We must put communities at the center of serving their own people. We know what to do, but we lack the political will, starting with the global solidarity. So it's possible, but we'll have to be bold. We'll have to be resolute in fighting to end. We know how to do it.
Yeah, thank you, Winnie. So what you're saying is that fighting AIDS requires determination, it requires funds for paying for the medicine, but it also requires an attitude within societies of openness, so that those who are most vulnerable can come out and do not have to hide for fear of discrimination or so. But one question I have, these rising figures you're mentioning, is that due to the pandemic or?
I will tell you why. It's because several reasons. One, the response was already not on track before COVID.
All right.
It was already not going well. The decline in new infections was slowing. And in some regions, it was beginning to increase, like Latin America, like Eastern Europe. In Eastern Europe and Central Asia, it is increasing among people who inject drugs. And that is because of the punitive approach to drugs by governments in that region. That is because also of homophobia and discrimination against men who have sex with men. So if we could push back to get those governments to turn to a harm reduction approach, where people who inject are not treated as criminals, but rather as mostly people who have mental health issues, and you use a health approach of substituting the dangerous way of injection with other drugs that don't transmit, we can reduce it. And it is happening in a few countries where they use that approach. In others, it is about, in Africa, it is about men transmitting to women, heterosexually transmitted mainly. And we find that it is girls and women most at risk. Why? Because girls are not in school, they are preyed upon in society. It's a patriarchal society. Men are very macho. The masculinity is about being forceful, not being gentle and kind. So little girls are preyed upon. Young women are, sex is forced. Unwanted sex is the main reason. There's also transactional sex. Women being so dependent, lacking income, economic insecurity. You find young girls actually going out to earn money through sex because they want to bring home food. So there are many factors to do with poverty, to do with inequality, lack of opportunity, education opportunity especially, lack of sexual and reproductive services. Half the women in Africa cannot access sexual and reproductive services, including treatment or for STIs. So all these factors lead to the higher vulnerability of girls, of women. And we have to do more to close those gaps, because even though we have condoms, even though we have PrEP, it cannot solve the problem of forced sex, sexual violence. It won't solve the problem of society, of toxic masculinity, forcefulness of men and boys. These have to be solved too. Yeah.
Yeah, yeah.
But then, now we have COVID. It came and disrupted the work we are doing. Then we have the consequence of this war. The war in your neighborhood is hurting people as far away as my own country, Uganda, because fuel prices have gone up, food prices have gone up, everything has gone up. There isn't enough money within the government to pay for services. So
Yeah.
all those are affecting our HIV response.
Yeah, absolutely. Yeah, thank you for painting the whole picture, from discrimination, unjust gender relations, to intolerance, and to the financial pressures which exist now as a consequence of the war. Now, what I remember is is the importance of public information and awareness campaigns in the case of HIV/AIDS. Now, for me, that is one lesson we could have drawn for dealing with the pandemic now. But what, according to you, what lessons from HIV/AIDS could have been used or were used for dealing with the COVID-19 pandemic?
That is indeed the one you have mentioned, is one of the main ones, which is about the role of communities in fighting a pandemic, whether HIV, whether COVID. We saw it here with COVID. When COVID hit, even the very rich countries, those who had privatized systems of health, public health, those who had fragmented systems, those who had systems that were mainly curative but not engaging communities on prevention, they struggled and they were rich. But some poor countries who had built their public health system that is rooted in communities, that works more on prevention, those countries were able to prevent. So we're seeing that the way you provide public health. I was in Spain, for example. Spain fought hard, and Spain was able to control for COVID much faster than many other countries in this region. I think mainly because they have a public health system that is accessible by all people, and that in some ways is also more connected to the local communities. I don't know much about the rest of Europe, but I think parts of Europe struggled also because a community approach wasn't strong. South Africa is a country with the highest number of HIV, people living with HIV. But we saw them making good strides, even though they were hit very hard, because they had developed a whole local infrastructure to fight AIDS that was based in the communities. So that's one. The other way is about human rights. This I found so sad, because in some countries, when they were hit by COVID, like in mine, you see, we are quite like a military regime in my country. So the strongman leader of our country wanted to use a military approach to solve the problem of COVID. So you found that those who use forceful means, public safety measures that are forced on people, not made by consensus by communities, were also doing so badly. But those who empowered communities, those who put human rights at the center, did better. In my country and in many countries, we did a human rights report because we're getting so many stories about sex workers being denied social protection, transgender people being denied services because they would say to them, bring your identity card. Hey, they don't have, because they are not able to say they are male or female, and so they have no identity paper, so they could not access services. Gay men were being arrested, accused of spreading COVID because they are in shelters huddled together. They are not social distancing. Hello? How do you social distance when you are hiding? So all these human rights violations led to more problems. So human rights, when you put them at the center, when you respect them, you fight better. And the other thing is about data. Knowing your epidemic, knowing where it's coming from, who is at risk, and putting your policies, making your policies respond to your data. But as you can see, in many countries, surveillance systems were very weak. And those who used their surveillance to bring the knowledge were punished. Do you remember when South Africa?
That's right.
Because it has a very well-developed surveillance system, because of fighting AIDS, the history of AIDS, but also a lot of investment in public health, they came up and they found this variant. And for telling the world that there's a new variant, they were slammed with travel bans. They were punished. So again, you see that the international community was not taking the best lessons. Our best lessons are that share the evidence, know your epidemic, use it to respond. So that we were failing. And then, of course, the other lesson we learned is that a pandemic, in a pandemic, you need to fight together. That was the first lesson that was not respected. Because instead of coming together, countries looked inward.
And closed their borders.
Closed their borders.
Right.
They thought they could solve the problem for themselves. That was ridiculous. The virus doesn't ask for a visa, it just comes. So those were the things we have learned from HIV/AIDS, that when we come together, fight together, we make progress. That laws like travel restrictions, used to have them even in America, where people, if you are living with HIV or denied entry, that these actually just don't work. People will lie anyway. But on the other hand, if you are open, they will come and declare themselves and get treatment if you do not deny them. So, yeah, many lessons we have learned were sometimes used, but many times not. The worst one is about sharing technology. That was really a disaster.
Yeah.
We can come to that if you want.
Yeah. That's. I read your article on that about having. But yeah, you're right. I mean, we can go directly to that actually now, because. No, I think maybe you just tell us.
Yeah.
Go on with the way you tell us about
this
how you.
For me was the saddest part of it.
Yes, absolutely.
Because we know from HIV, we saw the bad experience, we lived it, we did not need to repeat it. When antiretrovirals were first found, and that was around 1996, they were priced out of reach for most people in developing countries. But meanwhile, people in the rich countries were getting them and were now not dying. For 10 years, it took 10 years before the prices of the antiretrovirals came down and people in our countries could also be given those tablets. Meanwhile, 12 million people died. 12 million, mostly in Africa. most of us who come from these East Southern African countries where we're most hit, we have family members. Almost everyone has someone close to them who died. It was that bad. Doctors died. We lost our productive people. All because some companies had the monopoly and were not letting the price come down. Now, we learned from that. We knew it was going to happen. We saw the governments do the right thing. Your governments here put money into companies to find a vaccine. In 1 year, they had found it. But even us, within that year, we knew that even with a vaccine, not everybody will get it unless the rules change. So we built a coalition with Oxfam and others to say, and we started arguing before the vaccine was found. We said, please, even before it's found, let us put there a system for distributing this vaccine so that as soon as it's found, everyone is served and we are out of it quickly. They didn't listen. Each country was looking after itself, and when the vaccine came, you all know what happened. We went to the WTO to ask for a TRIPS waiver. We should not have been asking for a TRIPS waiver. What we should have been doing is to put in place a new system for rewarding drug production and distributing. That is what we should be doing. Finding a new way to reward companies for their innovations and quickly distributing to everybody so that, we didn't need to sink our economies. All these people didn't need to die. The lockdowns, all of that, we could have finished with that in a few months. But we didn't, all because governments want to allow companies that are based in their countries to decide how much vaccine to produce, how to price it, who to supply it to. So who lives and who dies is decided by a few companies, a few owners of business. How can that be right? And then they've taken public money. BioNTech is a company here. BioNTech got about $500 million, some from your Ministry of Research and a loan from another development arm. For all that money it took, together with Pfizer, when they got their vaccine, they didn't even want to sell it to developing countries. Developing countries wanted to buy. They only got about 1% of the total production from Pfizer. Why? Because they can do it. There's no other reason. Why? Because they can create artificial scarcity and keep the price up. It was shocking. At some point we found that a country like Ethiopia was paying, and South Africa were paying more for the vaccine than European countries. Because they can charge what they want. So we must change that. This system that is used to develop drugs, life-saving drugs, and distribute them does not work for pandemics. It hurt all of us. No country was not hurt. We are still recovering. We need to change those rules. We shouldn't talk about remove the barriers for COVID. No, we should say what's the new system that governments will legislate so that they put in money like they put in money, but they accompany their money with rules. Public money should be followed by rules about how to distribute. So we had a bad lesson, very, very bad lesson, and we're all hurt. Today there's a discussion on a pandemics treaty. The same companies have come with some document of their own. Basically, they are trying to keep their monopolies and pretending that now We want that the next pandemic, there is equitable distribution. They didn't do it last time. Why should we believe them this time? But they are involving themselves in this discussion because they want to continue entrenching that privilege they have. Mm-hmm. We oppose it. And I'm so happy we are here to speak about that. Because somehow, this is a powerful country, very rich country. Mm-hmm. It has it within its means to change, to call for a change of the rules. Mm-hmm. We need to change the rules. It doesn't mean companies don't make money, but they must be regulated. Mm-hmm. Get a decent profit and get the medicine to everyone. Mm-hmm. I'm sorry, I'm passionate on this.
No, I think I absolutely share that. Yeah, no, I absolutely share that passion. I was told...
Let me tell you how obscene it is.
Yeah,
I have some data here. Pfizer, we checked their profits last year. Oxfam is so good at this. They checked. They found that Pfizer made $37 billion of profit from COVID vaccine only. 37 billion. Then in the last 2.5 years, this vaccine has created 40 new billionaires. 40 new billionaires. People making a fortune of that kind. As doctors and nurses and health workers die in other countries. It's immoral.
Yeah, I agree that this is obscene, actually. I mean, Oxfam has also published data on how rich people have doubled incomes, while so that how the gap, the inequality gap has increased due to the economic effects of the pandemic. And we know that these effects will be prolonged in time, because you mentioned the lack of education. So it's girls, but also boys, and we know from studies that when you miss out education in early age, it has a long-term effect on your income over life. So this is how it's going to be replicated, actually.
Absolutely. We have counted the people who died from COVID, but honestly, when we start to count the social and economic cost, the toll is huge. The girls who didn't go to school, who became pregnant, whose lives have completely changed and may never return to school. The people who died because they couldn't access food, so many. The people who lost homes. I mean, the devastation was huge. In the developing countries, there was no cushion whatsoever for people, for little businesses. So I think that somehow I would have expected that the world would now be coming together to say never again. The next pandemic must find us united, must find we have systems for putting down money for innovation and putting down a system for distribution. But it's not happening yet.
I think we will soon open for your questions. But before we do that, I would like to ask you one thing. You know, I'm working with this group of scientists on the next Global Sustainable Development Report. And we are focused trying to gather the scientific knowledge which is there for understanding why progress is slow, and then from that infer how it could be accelerated. And one point we try to make is to strongly argue for reducing inequalities and therefore promote a universal social protection and including a universal health coverage. But when I read your articles and when you retold this story now on the pharmaceutical system not learning from HIV/AIDS for COVID-19, and I was wondering, is it sufficient to go for universal social protection and universal health coverage, or do we need actually to focus on on declaring health systems, health services as a public good. So what would be the thing you bet on of these three?
Honestly, I would bet on making healthcare, education, a clean environment, global public goods. They should be. This should be the entitlement for everyone who is born in this world, wherever they are born, that they have a system of publicly provided health care that they access, whether they have a job or no job, they must be able to access health care. The same with education, and the same with social protection, and breathing clean air and having clean water. This, for me, should be global public goods. And we should find, it should not be difficult to have arrangements that guarantee these. Because when you think about it, there is enough food, for example, for everyone to eat in the world, but people starve. It's about the distribution of it. The same with healthcare. We have the knowledge, the medicines. We know the scientific knowledge is there for most diseases, even those which don't have. It's because money is not being invested in many of them. They are either rare diseases or diseases of the very poor. With more investment, we can find the solutions. But people die today, more than 10,000 people will die because they can't access a clinic. They cannot afford, or it's not near enough. So we can have a collaboration between countries where we all pay a tax. The tax can be as you earn. If you're a poor country, you contribute less. If you're rich, you contribute more. And out of that, we all draw our health. That is what we need. We should have learned by now that diseases flow, pandemics flow everywhere. So the only way is to guarantee everybody's health. I sincerely believe that, not just because it's what works, but because for me it's what's moral. People should not be born into a world of, look at these people with all this money. What do they use it for? Think about it. They take all this money, when they become billionaires, they don't use that money to buy more fancy cars and works of art and yachts. No, they put it back to influence the laws of their countries, so that now they buy the lawmaking process. So now laws are about reducing their taxes, laws are about, giving them unfair advantage over ordinary people. That's what happens. And that's why today you can go to WTO, argue about removing the barrier for people to get a treatment, and you can't. Because these companies are sitting, they're the ones making the laws of those countries. The people who are our politicians, they are elected, but really, they no longer get elected because they are the most popular. They are the ones with money. They buy elections. Pharmaceutical companies, I used to have a figure of how much money they put into electoral processes here in Europe and in America. A lot. They give contributions to politicians to get elected. Financial institutions do the same. And when they when they are elected, they put money to lobbyists. They are pumped. If you go to Brussels, you will see how many lobbyists zoom around the corridors. They are paid, it's official. They are allowed to come to represent interest groups. Lobbyists for pharma, lobbyists for banks, lobbyists in America, there are even lobbyists for selling arms, I mean, so where is the ordinary person? So the democracies are hijacked by billionaires. That's what happens. So we do need to reclaim our power so that we can have global public goods. Today we don't have what we need because our voices are not heard enough. Me, I come from a country with a person who has been in power for almost 40 years, so we don't even claim to be a democracy. But here, where you are democracies, you have to ask yourself, who are these elected officials representing if they are taking money from interest groups?
Yeah, we have a lobby register, and we have slowly increased the obligation to a report, but there is still room for improvement.
Yeah.
I think what I understand, I know it better for the United States, because there it is so crass, it's so open, how the influence of big money deteriorates the trust in democratic elections and in the system, so that people just restrain from voting, although they are also actively hindered by how laws are and voting districts are defined. But I think when you remember the Trump elections, he wasn't the man with most money, and still he got elected. So I think there is a limit for hijacking elections, but it does not always go into the direction one would prefer. But I think that public goods is a very important approach for securing the foundations or the basics of life. And if they are commercialized, that makes it much more difficult to fully commercialized, to have equal access to quality services, and and thereby contributing also to equal opportunities, actually.
Absolutely. The idea of global public goods, this is its time. What we have been through in the world, not only on the pandemic, COVID, but also the fact that we are on the brink of roasting ourselves out of existence, and we are staring at our planet warming, and we are seeing droughts, we are seeing floods, we are seeing countries perishing, and we are unable because we have not made it a global public good. Countries that need help to adapt do not have the money. Mitigation is not happening at the pace that will restore, reduce the warming. So we are not able to deal with global problems because we have not taken an approach of this must be a global solution. Instead, each country is supposed to find its own, what do they call it? Nationally determined
contributions.
Contributions.
Yeah,
what is that?
Yeah.
We shouldn't be asking countries to decide how much they are going to do to. No, we should be having.
Yeah, but it didn't work out in Paris. It was the only way to get it,
Exactly.
to get the agreement. That's true. But Winnie, let's invite the public to join our conversation. So maybe you have made up your minds and have questions or comments you would like to share with us, or questions you would like to ask Winnie.
Otherwise, this old woman will keep talking and talking.
Yeah, maybe you... I see someone there.
Hello. Thank you so much for this conversation. I almost feel emotional listening to this really, really, true conversation, I think. So I have a question, because you said earlier, Winnie, that you would have expected that at this moment and after what we've seen in this pandemic, and you've painted the picture of injustice very clearly, that the world would come together and actually say, what do we need to do? We can never repeat what just happened. We know the next pandemic is coming, and we have seen even in the previous HIV pandemic, and now we've repeated mistakes during the COVID pandemic. And I mean, I very much agree that I would have also thought this would be the moment where the world would come together and say we cannot repeat this, but I think a lot of other people, especially I spent the last 3 days at the World Health Summit, and a lot of people there, I would say, think that actually we have done very well during this pandemic, and a lot of things should be reproduced for the next pandemic. So my question is, what would you say to, especially maybe German decision makers, as we're in Germany, who think that we've done very well? What would you say to them to try to explain actually what needs to be changed in a few words? I hope this was clear.
I think those who are saying they've done very well probably, I don't know, what data do they use? I don't share the same. I mean, how many million people died? Did they have to die? Really? Look today. I think now I have had my 4th vaccine, COVID vaccines, my 4th because I live in Switzerland. But millions of people in the developing countries haven't even had one. Mm-hmm. How can that be success? And what does that mean? The scientists tell us it means in those countries where vaccination hasn't happened, it is the breeding ground for new variants. We cannot be sure that another horrible variant is not going to emerge in a year, in 4 years, and come to haunt us again. How is that success? When you have the vaccine, but you are not vaccinating the whole world so that we get this virus out of existence. How is that success? Then look at the economies. Look at how many people lost jobs. Some have not returned to work up to now. So how is this success? I just don't see how it is success. But, you know, there's a way they like to wing it. Again, as I keep saying that this is about those who have captured the decision-making process. The big pharma, the billionaires want to make it look like we have recovered, COVID is over, everything is going to be fine, let's look at other problems. It's not so. People who lost jobs, people who died and are still grieving, lost their loved ones. Some are still in pain. So I really don't see, in the face of pain, in the face of death, in the face of economies that have not yet fully recovered, I cannot see success. I don't see success. They must be reading other data.
But maybe a difference is also that they just say, looking at the situation in Germany, but what you had said is you cannot claim a pandemic is over when it's not over universally, globally. And that's why you mentioned also the international or global solidarity. So you would actually say, you cannot say a pandemic is over when it's not over anywhere, or when vaccination rates are not high everywhere.
No, absolutely. It's not over.
Another one?
Thank you very much. My name is Bernhard Brauner. I'm actually working for the German government in the Federal Ministry of Economic Cooperation and Development. I think nobody would argue that the pandemic was a success and that it was something positive, not at all. But I think there are certain elements that were more successful in fighting the pandemic than in other diseases. And maybe it's in this comparison where success comes up. One is the coordination of many public health organizations under the Act A. You didn't mention that. And the COVAX pillar that was providing 1.6 billion doses of vaccines to low and middle income countries in a very short period of time. In comparison to the reaction to other diseases, also that could count as success, maybe. But my question is, how do you see these international coordination mechanisms in the pandemic? What's your experience in comparison to the HIV/AIDS pandemic that you've worked on for so many years?
Mm-hmm.
Thank you.
Good question and good. Okay, first let me say that I'm not all negative about what happened. If I look for some successes, I can see some. One success can be that rich countries were able to put money down, and scientists were able to race and get a vaccine in record time. I think that was unprecedented. And that is so important. And now, through that innovation, probably we can also now get other vaccines and treatments based on this mRNA technology. So, innovation, money for innovation money coming and spurring innovation is a success story. But then the failure is the distribution. So when you say COVAX, that was set up as a mechanism to help developing countries also access the vaccine. Now, that one is very interesting because another success story is that African countries, when actually countries that are rich were looking inward, for Africans, they came together. They said, we're going to sink or swim together. They came together in the African Union and were asking to buy together. We are asking to buy PPE, vaccines, and they were pooling together, which was a positive thing. But now, COVAX was a mechanism where countries like Germany and others were putting money to help developing countries buy. That's a good thing. But you see, the problem was not so much the money. The problem was there was no vaccine to buy. You see, COVAX was sitting there, waiting also in the line to get vaccines to buy for African countries, developing countries, with money given by rich countries. But the same rich countries gave the money, the same rich countries hoarded the vaccine. They were in the front of the queue getting the vaccines. Africans, we were at the back of the queue, even with our little money, unable to buy. So the issue was scarcity. The initial problem was scarcity. And when we said scarcity, they said, no, it's not scarcity. You don't have capacity to distribute in your countries. You have a problem of distribution. No, these vaccines were arriving late, almost expired, without notice, enough notice. There was no predictability because Africa was getting the leftovers. It's true, I'm being honest. So there was no predictability in the system. There was a long wait. If you have to go 4 miles to get your tablets, to get the vaccine, and you reach there and they tell you, oh no, today we have no supply, you go back home. Will you come back the next day? You may not. So there was even vaccine hesitancy because there was a promise, it never came. We know that hesitancy comes from such failures of the system. So I have to say that while there was some generosity from the rich countries, we failed to have a global plan. Like in HIV, we failed to say the demand for the whole world is so much, we need the producers to make so much, so that we distribute every month. Like we set, can you imagine the governments of the world were setting targets? By this month, we should have vaccinated I don't know, 40% of the world. You set a target, then you also put a plan to achieve a target. You don't set a target with no plan. There was no global plan. There was no global solution. So I still feel that the failures were enormous. Some generosity was there, some solidarity was there. It wasn't zero, but didn't match the problem. So it depends on where you set your bar. If you set the bar so low, you can say, okay, we managed a little. But if you set the bar a little high, like you put it at the bar of HIV, you can see what the world achieved for HIV. Much of that was not achieved. You know, in HIV, we are UNAIDS. We lead and coordinate a global response. We set targets. We bring a strategy, which is the pathway to achieve targets every 5 years. We review those targets. Governments of the world come and commit for the next 5 years. This is how we have moved for 25 years. This is how we've brought 38 million people on treatment, because we've had a global plan, global solidarity, money, we monitor, we estimate how much money is needed, we raise the money, we put it, this is the global fund, money is put there, it's shared between countries. So there's a targets, strategy, plan, resources, review. All this happens with HIV. We didn't manage to do all of that. Instead, every country was stepping over another to get most vaccines, declared targets with no plan. So I think the world was not in a good place. Multilateralism was weaker when COVID hit us than 25 years ago, when countries could make a decision together and move together. We need to rebuild multilateralism. Yeah. But that's not to say that countries didn't help. They did, but it didn't measure up to the task. Yeah. Germany was very generous. So was the UK with AstraZeneca, which was made in their country. Yeah, so was the United States with Johnson & Johnson, but it didn't really help.
It wasn't sufficient.
It wasn't at all. It helped only a little.
Further, yeah.
Yeah, hello everybody. My name is Roman. I come from the Foundation. We are running programs in Central Europe, in the United States of America, and also in Eastern Southern Africa. One program we launched together with you and the First Lady of Namibia. I don't know if you remember last year in April. It is a condom distribution program we are running right now. And I see a lot of synergies when it comes to HIV or same topics and COVID. And what we see is that it's not only about availability of medical products in a country, because in Southern Africa, let me take South Africa as an example, because I'm living there quite a long time in parts of my years. We see that PrEP is available, we see that PEP is available, and it's for free. We see that testing is available, we see that condoms are available, but they are available in theory. So if you talk to young people, they have to go to nurses to get the condoms. If we talk about testing, if there are testing trucks in front of the TVET colleges, nobody will go there because young people are very afraid to be stigmatized, to queue in line for HIV tests, because who are you? Are you a sex worker, or do you have so much sex that you have to test regularly? So what we see is that there are many barriers holding especially young people back from taking medication, from going to testing, from going on treatment, but also to use condoms or prevention methods such as PrEP. Another very important point is, and I think there is also the connection to COVID, is even though from a certain moment in time the COVID vaccination was available in South Africa, young people don't trust the government, and they don't trust the vaccines, and they don't trust pharmaceutical companies. It's the same with PrEP. Young people say, okay, why should I take a pill every day to prevent taking a pill every day? And so I think a very critical question is, and I see it all the time, especially also in rural areas in Southern Africa, also in Namibia, how do we make sure that young people, again, gain trust in the United Nations, but also in medical products, which will be the only, solution for HIV in the long run, but also for COVID. Because, I mean, in South Africa, we have hardly reached 60% vaccination rate. And the vaccines are available. So there are tents everywhere. You can get vaccinated today or tomorrow or the day after. And so I guess that is a very critical problem, and I would like to learn more how you also under your leadership, and I really appreciate your leadership because you have your ears very close to young people in every region, and you are bringing us back on the agenda. I would like to learn how you want to manage in the future to gain the trust we have lost in the world in the last years.
Mm-hmm. You are so powerful. All our data tells us that the most at risk of this pandemic, HIV, are young people. And also our data tells us that where young people are empowered to deliver services for themselves, it works. They come forward. So where we have gay men, young gay men, with the capacity to serve themselves, to test, to give treatment and care, that is where we are seeing success. In Ukraine, for example, Ukraine has the second largest pandemic, HIV burden in the region of Eastern Europe and Central Asia. But it also has the most successful response, and that's because they have networks of citizens, communities. They have a community approach, community-led services, community monitoring of services. So even with the war, people have been able to follow the people they have been serving and continue services to them in the country, in Moldova, in other countries where they are fleeing. We are able to continue supporting communities to serve themselves. So that's the same with young people, that really until we have services that respect, that reach young people where they are, not ask young people to come where they want to be, where the government wants them to be, but people that young people serve themselves and reach their own people. That is what we know works. It's not happening in many countries. It isn't. Again, you also mentioned the issue of trust. Trust is an important one, very, very important one. And trust comes, I don't know how to put this, but take this case of HIV. Almost 38 million people are on treatment. Another 10 are not yet on treatment, but we know they are living with HIV. We need to find them and put them on treatment. But you have to ask yourself, where did the trust come from for those people to come on treatment? Because there's also something about a disease being life-threatening and people wanting to live and coming forward to get it. Those who are not getting it, you might say it's lack of trust, but I would think that it's mainly human rights barriers. They can't come forward because they are being beaten down by the law. It is discrimination and stigma. What you've just said, young people are very sensitive to stigma and discrimination. It is inequality of opportunity that places some people at high risk, like girls. The issue of trusting the service provider is also important. but I would not place it before these key barriers, like human rights, like inequality of opportunity, like sexual violence that's tolerated in society, social norms that disadvantage certain groups of people. I think those are the biggest obstacles we have, and they affect young people more than older people.
Can we continue?
Yeah.
Yeah, I'm almost sorry to turn away from the last question. It's fascinating to hear your answer. But I wanted to get back to what you said about the big disappointment, you know, the COVAX and how COVAX also failed people, as your data shows. Because the promise was bigger, and our own chancellor made a bigger promise than what turned later to be a mechanism that you said we have to undo it and invent a new one. Now my question, Winnie, is, and thank you actually for not turning out to be angry, because I feel that so many of my friends on the African continent are actually rightfully angry also about what happened, and especially at this time. There were so many other times that the rich industrialized nations failed African nations, but this time it was felt very hard, and it created a lot of anger. And I think that's one of the effects we are not analyzing for ourselves and our relationships globally enough. But I'm asking myself, you know, from the moment when the promises were higher, there was a moment that it seemed close to solidarity, a global solidarity, and then it failed, like you said. And the job is not over, like you're saying. I mean, so many people have not gotten one vaccination, be it out of skepticism or any other reasons, and lack of vaccines or lack of proper distribution, etc. So we still have a huge job to do. So we should not stop here and say, well, this pandemic, which for us is over for everybody, so we can look at the next pandemic and how to be prepared. But question basically is, it didn't, to my experience talking to people around me, it was not so much the lobbies that I felt against me, but I felt that certain arguments were stronger, and people would not step beyond these myths. For instance, the health system in African countries is not strong enough to manage. And South Africa, for instance, did sequencing and everything. I mean, it was so well organized, up to the communities then organized, as Winnie rightfully said. So how can we better stay tuned in convincing that these arguments are false ones? I hear them from liberals and progressive people, basically also unwilling to undo the very capitalist rule of, you know, profit making above everything. That's why we chose the title tonight. So what do you make out of my bubble here and unstructured ideas? Sorry.
No, you're making a lot of sense. I think we are kindred spirits. I feel what you feel. There was we didn't underestimate the difficulty of dealing firmly with pharmaceutical companies on the issue of producing enough supply for the world. We didn't think it was going to be easy. That's why we started our campaign before the vaccine was found. We're already campaigning and saying, if a vaccine is found, it must be a people's vaccine, a global public good. That was our campaign. Because we knew that it was not going to be easy. Because I have to repeat this, because two interest groups really are controlling democracies in the West. The pharmaceutical companies. You can also add others, you know, there's the extractive industries and all those. But those two, at least I have followed. You can see just how much money they put into lobbying the parliaments of these countries. It's so much. You're talking of hundreds of millions of dollars every year that they put through to their lobbies to lobby parliaments. And they don't lobby because they want to find a cure for malaria. They lobby to get tax cuts, to avoid paying their taxes. They lobby to maintain their monopoly hold so that they can control prices and maximize profits. Those are the reasons that they lobby. And so it was always going to be very difficult to overcome their hold on power. They have been holding power for a long time. But it wasn't always like this. These intellectual property rules, they came only like 20, 25 years ago. Before, most manufacturing of medicines was happening within the borders of a country. The government would invest in innovation through its universities, its research system. Companies would also benefit from that research. And when an innovation came, it would be regulated, the price. When the polio vaccine was found by this man, Robert Salka, was that his name? I'm trying to remember his name. He was an American man, and he was interviewed by the press. They said, so, Mr. Dr. Salka, are you going to get a vaccine? Are you going to get a patent? Mm-hmm. And he asked, he said, no, can you patent the sun? This was that time. Can you patent the sun? To him, it was a global public good, like the sun. We all enjoy it. And so just to say that this whole idea that you can sell a life-saving vaccine the way you sell a pair of shoes or a handbag, it's just unbelievable. We believe it now because it's happened, but it never was the case. Medicines that save lives, the government puts in money to make them, must also control the price so that those who need it get it. And a company, why should a billionaire decide if I should live? Why? Why should my life be determined by? It's just wrong, but it's a norm that has been set over time, and we've accepted it, but it's an injustice. So to come back to you, the world was sometimes close to a solution when government put its money, when they put their money down to companies to find this, they were close to a solution. When they came together and created that ACT accelerator with the COVAX thing, that was an attempt at global solidarity, but it was weak. It had flaws. You can't set up a system of COVAX which is about pooling money for the developing countries when the problem is not just money, it's also scarcity. You don't address scarcity, you put their money. So there was very weak responses. We never got close. We never got close. And we mustn't get to the next pandemic like this. We really mustn't.
Yeah, but I think what also happened, what I remember from the early times when we were waiting for the vaccine, the public pressure also there was a lot of public pressure on European governments to hoard. To hoard, and to be the winner in this competition, who buys many doses. And I remember very well how the European Union was criticized. I mean, Ursula von der Leyen was criticized. She didn't buy enough. That was the main tone in the press. And so I think that was a very negative spiral. And probably what we need is a very thorough analysis of these phases of dealing with a pandemic, and it should cover, I think, to your question, Kirsten, I think it should also cover the different ways, and I try to identify the obstacles in different world regions and countries, so that we get the picture as a whole and understand what has to change by whom. I think, of course, what you say, you're right. In a world which is characterized by such big differences in power and in purchasing power, then how do you achieve global solidarity in such a situation? And in a pandemic where the medicine wasn't known, where the virus wasn't known. But is that part of the pandemic preparedness exercises in the WHO, to identify, to get this whole picture and to identify the flaws and learn from well, not successes, obviously?
I'm keeping my ear to the ground on this process of the pandemics treaty and the work that is going on. First, I am hoping that this will not be just an exercise about solving one part of the problem, which is the sharing of information about a pandemic. Because honestly, there would have been no pandemic when at the first outbreak of COVID-19, information had been shared about it. We would never have had a pandemic. But we had a pandemic because information was not shared. So that problem is very much being addressed through this. There's an attempt to strengthen the WHO, because it is the organization that has that mandate to enable it to be able to move quickly where there is an outbreak, to get information, to share it, and to stop a virus spreading. That is good. But if we stop only there, we will not have solved the problem. We really will not, because we saw that as the virus spread, many countries, rich and poor, were not ready to prevent. They were just not ready. Their health systems were not ready for prevention. They couldn't kick in a system of sending messages and supporting people to prevent. This wasn't possible. Health systems in our African countries and many developing countries were already crumbling. Investment in health was reducing as debt repayments were mounting. Many of our countries were already in an economic crisis, the debt crisis. So systems were not working. So unless we put more into strong health systems that provide health for all, that are accessible by everybody, that are driven by communities from the bottom, the next pandemic will still hit us so hard. So it's not just an information system, it is also about the health system, it's about communities and how they are reached, community health workers. It is about the production of medicines, the innovation system and how drugs are sold. So we need to have all of that resolved. Solving one part of it will leave us still vulnerable. So I'm following the discussions. This one about the trips, we are worried because we had hoped that they would extend the small waiver that was there, if you can call it so, to treatments and tests. And now you start getting Big Pharma coming in again with their own disruption. I think they have a declaration they want to bring in that isn't really, that is intended to entrench their monopolies rather than to open them up, open up the system of production. So I'm a little optimistic about that, but not 100%. But it's not the main thing. The main thing is the pandemics treaty. If we can get as much into that as possible, if we can get in more than, if we can get in the importance of human rights, if we can get in communities, strengthening of health systems and funding for that, then we are somewhere.
Yeah.
Then we're getting somewhere.
Yeah, that's the WHO Accord on pandemic preparedness and recovery. Yeah, I agree with that. And what you said now, it actually summarizes what we have been talking about, to put human rights in the center, the community, but to have a strong or at least sufficient health service as such to build upon. And that should include a strong public health service as well. So, and to be able to deal with treatment as well as gathering the information, because in the beginning you said, know your pandemic.
Know your pandemic.
And that is something which we also were very bad at in the beginning in Germany, I must say. So know it, have the infrastructure to gather the information and to reach out for treatment and for diagnosis and treatment. And then I also understood that you said, be aware of all the other impacts and costs associated with it, the social impact, the economic impact, and cushion that as well.
Absolutely. And I mean, it's not just the health system, it's a social protection also.
Yeah, exactly.
It's so painful to see here old people dying, mostly because it was hurting old people. But you could see that in some countries, they moved quickly to protect their, they had stronger systems of social protection, so their deaths were less. We saw how in our developing countries that it was the poor, the very poor were dying because they couldn't, there was no support, no food support, nothing to protect them. So it's also the things around the health system that are needed for people's health. Social protection is important.
Yeah, I'll keep that in mind for the Global Sustainable Development Report. I'll tell my colleagues at the group of scientists about this evening. And I would like to thank you very much, Winnie, for having joined us after heavy 3 days of global conferencing. And I want to thank you for having been with us, and I invite you also.
Yes.
Thank you.
Thank you so much.
Thank you so much.
Also to you, Imme, for guiding us through the conversation. Thank you to you, Winnie, for being so honest with us today, for challenging us also to think maybe a little bit different about the things that have been said in the past days and the processes that are to come. We would, also like to show some thanks, maybe nerve strengthening for the voyage home tomorrow, for the next train ride, Imme.
Hey, thank you so much.
Thank you so much.
And yes, like Imme said, we would like to invite you for some beverages, for some finger food to continue the discussion. And I'm so happy to see so many familiar faces here tonight. Thank you all for coming.
Thank you.
Thank you.
Thank you. Well, we can bring the chocolate to Switzerland.
Thank you.
All right, let's get rid of the